Recording in progress.
Good morning, honorable members, staff of parliament, the media, South Africans, and all those that are interested in following our meeting today. Good morning to all of you. Can we start our meeting by observing a moment of silence or meditation? Can we, honorable members? Thank you very much. Thank you very much. Honorable members, we are having this meeting. It is convened as per the invitations received, and it will be conducted as per the National Assembly rules. I like reminding honorable members that it will be good to keep yourself muted unless you are recognized to speak by the chairperson. We have an agenda in front of us, honorable members. It has been sent to our emails on time. I would like invite Ms. Machalamba or whoever is assisting to flight that agenda. I will at the same time be off video for a better coverage, honorable members and South Africans. There's the agenda, honorable members. It speaks to opening and welcoming, attendance, confirmation and apologies. The first agenda item being the briefing by the content advisor on statutory rape referral, consideration and adoption of the committee's oversight report on KwaZulu-Natal Province, consideration and adoption of the committee's oversight report to Gauteng Province, consideration and adoption of minutes, consideration and discussion on the proposed statutory by the Portfolio Committee. That is the agenda, honorable members. I will look for hands from those honorable members that would like to comment, agree, confirm the agenda. Honorable members, I will note hands as assisted by Ms. Machalamba.
Good morning and thank you, Chair. Ms. Shabangu and Ms. Sine's hands are up. Thank you, Chair.
Thank you very much, Ms. Machalamba. Let me start with you, Honorable Shabangu. Can you unmute yourself, Honorable Shabangu?
Thank you, Chair, and good morning to everyone. I propose the adoption of the agenda. Thank you.
Adoption has been proposed. Who else wants to comment? Ms. Sine?
Good morning, Chairperson. Good morning, honorable members and everyone in the meeting. I would like to second the adoption of the agenda, Chair. Thank you.
Thank you very much, honorable members. Is there no other hand, Ms. Majalamba?
No, Chair.
Thank you very much, honorable members. Let me take this opportunity to welcome you to this meeting of ours as the Portfolio Committee on Health. We must take time. The meeting is scheduled to take place from 9:30 and 12:30. We will see if we finish on time, but honorable members, please remember that we have a sitting, but that sitting is starting at 3 o'clock. Honorable members are welcomed to the meeting. We must consider the agenda that we have adopted. On that note, honorable members, I will invite Ms. Majalamba to confirm the attendance of this meeting, and also those that have apologized. Over to you, Ms. Majalamba.
Thank you, Chair. Present is Ms. Teko, Ms. Shabangu, Ms. Sine, Ms. Kumalo, Ms. Clark, Dr. Leroux, Mr. Mutubatse, Mr. Mchadu, Mr. Chiryo, Mrs. Chirwampungose, Mr. Van Staden, Dr. Litlape, Ms. Nhlongo, and Mr. Zungula, Chair. I haven't received any apologies. Thank you, Chair.
Thank you very much, Ms. Majalamba. It seems that we have the required quorum. We can conduct our business of the day, honorable members. I want to remind the meeting. Can I give it to you, Ms. Majalamba?
I was just saying Ms. Clark's hand is up, Chair.
Okay. Honorable Clark?
Good morning, Chair, and good morning to everybody in the committee. Chairperson, I would have to leave this meeting at 11:45 as I have a joint standing committee meeting as well today, which starts at 1:45. So I'll have to get from the park to Parliament in order to attend that meeting on time. Thank you.
Thank you, Honorable Clark. Your apology is noted. I think by that time we would have finished with our agenda. Thank you very much for that. I was still reminding the honorable members that as this Portfolio Committee of Health, we are amongst the committees that have been identified by Parliament to participate in the statutory rape inquiry. The committees that we are working with in that exercise is the Committee on Education, Portfolio Committee on Justice, Committee on South African Police Services, and the Committee on Women, Youth, and Persons Living with Disabilities. And that Committee of Women, Youth, and People Living with Disabilities is taking lead in the inquiry. That you will remember, we did receive an invitation and information on the program of stakeholder engagement to provinces, Gauteng and Eastern Cape, and that was the last day, yesterday, of that program that was shared with the members of the Portfolio Committee. It is then that we required the content advisor to come and brief us on the subject, just to remind us what is it about statutory rape, what are we supposed to do, which stakeholders can we involve and invite as health? I will, on that note, invite the content advisor to brief the portfolio committee. Thank you very much, honorable members. Over to you, content advisor.
Thank you, Chair. Good morning to you, Chair, to the honorable members, colleagues, and everyone present on the call. My name is Lindo Ngomane. I'm the content advisor supporting the committee. I'll just load the presentation. Chair, thank you for the opportunity to present this important referral on the statutory rape of young girls in South Africa. As a background, this matter arises from a House resolution adopted in August 2024 and subsequently revived in July and October 2025. The issues were that the team was not ready to conduct this engagement or conduct any public participation processes at that point in time. Hence, it was resuscitated following that adoption in 2024. It responds to the urgent need to address statutory rape, particularly where young girls are forced into motherhood and adulthood prematurely. This resolution acknowledges the failures in reporting and oversight and calls for coordinated parliamentary oversight. The resolution calls for coordinated parliamentary oversight and outlines a clear mandate. And this mandate consists of three core responsibilities. First is to develop a joint public participation program. Second, to review legislation or recommend amendments with a focus on mandatory reporting by teachers and nurses. And third is to report back to the House by 30 November 2025. The chairperson has already alluded to the committees that are involved in this work, and with the Portfolio Committee on Women, Youth and Persons with Disabilities as the lead committee. In terms of the scope, it is important to acknowledge that the scope and limitation of the referral. While the broader issue of child sexual abuse is deeply concerning, the current mandate is narrowly defined. It focuses specifically on statutory rape of young girls and the failure of mandated reporting, particularly in schools and clinics. The limitation must be kept in mind as members engage with stakeholders to formulate the recommendations. Statutory rape remains a serious social and public health issue in South Africa. In 2022-2023 reporting period, over 10,000 cases involving minors were recorded. However, underreporting continues to be a major barrier. Research shows that only a small fraction of victims report to the police. The prevalence of teenage pregnancies, including cases involving girls as young as 9 years old, underscores the urgency of this work. Furthermore, online child sexual exploitation is an emerging and underreported threat. Children are targeted via platforms like WhatsApp and Facebook. The country has robust legal framework in terms of statutory rape. The Constitution, Criminal Law Amendment Act, and the Children's Act all provide protection and reporting duties. However, implementation gaps persist, particularly in schools and healthcare settings. The work of the committees must focus on enforcement and accountability. In terms of the roles of the department, each department that's involved has a distinct role to play, starting with the Department of Social Development, which oversees child protection and manages the relevant registers. The Department of Basic Education monitors school-based abuse. The Department of Health is responsible for ensuring mandatory reporting by health professionals. The South African Police Service investigates the cases, and the Department of Justice prosecutes. However, interdepartmental coordination remains a significant challenge that must be addressed. The purpose of the engagement is to provide a structured platform for dialogue among key stakeholders, to clarify the health sector's role in prevention and response, identify systemic challenges and propose actionable recommendations, to strengthen intersectoral coordination and reporting mechanisms, as well as support the committee's oversight and policy influence on statutory rape and child protection. The main objectives and of this work, particularly on the health sector focus, is to clarify the role of health professionals, which is nurses, doctors, counselors, community health workers in detecting and reporting statutory rape, assess the implementation of mandatory reporting protocols in health facilities, identify the barriers to compliance, including fear of victim stigmatization, confidentiality, and lack of training, assess the availability of post-rape medical care, counseling, and sexual reproductive health services for minors, examine effectiveness of coordination and referral mechanisms between health facilities, the police, and social services, explore strategies to strengthen accountability and oversight within the health system. The proposed, the key stakeholders, just to mention, Chair, that this is a list of proposed stakeholders. The committee can decide on which stakeholders they feel that they should be engaged on this matter. We have the National Department of Health, which leads on policy and post-rape care integration. The South African Medical Research Council, which provides the data on prevalence, risk factors, and health outcomes. We have the Health Professionals Councils of South Africa, which oversees ethics and professional obligations and reporting duties. We have the Nursing Council, South African Nursing Council, which addresses issues of training, clinical protocols, reporting barriers. We also have the DINOSA, the Democratic Nursing Organization of South Africa, which offers frontline insights into clinical practice and reporting challenges. The expected outcomes from this engagement is to enhance the committee's understanding of the health sector's role in statutory rape response, identified gaps in reporting and survivor care, strengthen intersectoral cooperation and information sharing, and develop concrete recommendations for prevention, response, and data improvement. These outcomes will directly contribute to the policy review and oversight process. In terms of reporting and follow-up, the Secretariat will compile a report with key findings and recommendations. This report will be tabled before the committee for deliberation. Follow-up actions may include oversight visits, joint engagement with the other committees that are involved in this work, and then the referral of the recommendations to the relevant departments. In conclusion, Chair, statutory rape is a public health crisis requiring urgent coordinated action. The health sector plays a pivotal role in detection, reporting, care, and survivor protection. Stakeholders' insights will guide legislative reform and strengthen intersectoral accountability. That concludes the presentation, Chair. Thank you.
Thank you very much, Ms. Lindokuhle Ngomane, on that content about statutory rape of girls. The mandate came out as referring to statutory rape of girls, though during the visit, there was also a mention about young boys. there is that information that will come later, but the mandate of Parliament was that we conduct an inquiry about young girls, statutory rape on young girls. There you are, honorable members. You are given chance to comment on the content that was presented by Ms. Lindokuhle Ngomane. Ms. Majalamba will assist me in identifying hands. Over to you, honorable members.
Mix.
Chairperson.
Ms. Clark's hand is up, Chair. That's the first hand, followed by Ms. Sine, Ms. Kumalo, Mr. Mutubatse, Dr. Leroux, Ms. Shabangu, and Ms. Cherampungose. Thank you, Chair.
Thank you very much, Ms. Majalamba. In that order, honorable members, we will start with Honorable Clark, followed by Honorable Sine, followed by Honorable Kumalo, followed by Honorable Mtubatse, followed by Dr. Leroux, followed by Honorable Shabangu, and the last is Honorable Cherampungose. In that order,
Dr.
honorable members.
Klape's hand is also up, Chair. Dr. Litlape will be the last one.
The last one will be Dr. Litlape. In that order, honorable members.
And Ms. Majalamba, please include myself. Thank you.
Thank you. Ms. Majalamba was the last to indicate.
Ms. Mhlongo.
Ms. Mhlongo, thank you very much. Honorable Clerk, the platform is yours.
Yeah. There we go.
Okay.
My camera is not seeming to work today. I don't know why. Oh, there we go. Good morning, everybody. I have one question and then just a comment. I would like to know the recommendation in addressing the fragmented legal framework. How are we going to deal with that? And what would be a better way to hold departments and officials accountable on reporting? So just that question, Chair. And then, Chair, just out of my own experiences, I really feel that this is an absolute epidemic in our country. And you find that young girls are coerced by older men so-called blessers in order to perform sexual favors for them in terms of assisting them, so that they can get some kind of income in order to feed families and take care of other issues, etc. Now, I used to, Benoni was my constituency for a very long time, and Davidton had a very, very big clinic right next to a Tutuzela center, and then the police station was right behind it. And there was absolutely no synergy between the clinic, the Tutuzela center, and the SAPS to deal with statutory rape, because the first port of call would be the Tutuzela care center. And then obviously, you need to get SAPS on board to open a case. And then the clinic also needs to assist from a health perspective. And this really wasn't happening. And my experience was that young girls felt intimidated to go to the SAPS to report these cases because they felt that, they were treated worse than what the perpetrators were treated. And that is something that really needs to be looked at, because we cannot have that situation. I mean, we saw, I think it was the Mother World Clinic in the Eastern Cape, where a young girl arrived at the clinic, severely gang raped, and she was just told to go to the police station, and she died at that police station. So it is time that our departments that are involved also are trained in terms of having human empathy for cases like this, and ensure that young girls that are raped and that are underage know exactly how to deal with the processes. Thank you.
Next member.
Thank you, Chairperson. Let me appreciate the presentation by our content advisor. The presentation highlighted the implications, health implications, and the referral pathways, and also I think we need stronger collaboration, as the presenter mentioned, the different departments in terms of collaboration. But I want to check with our content advisor in terms of the NGOs, where are they located? Because I believe they're also playing a big role in assisting interdepartmental, activities to be a success and also to support. I just wanted to check with that one, Chair, because I think I missed that part of NGOs. Thank you.
Thank you. The next speaker, Honorable Khumalo.
Thank you very much, Chairperson. Greetings to your good self, members of this portfolio committee, and our officials. Chairperson, just few things that I want to raise in this meeting. The issue of committees, these committees must focus on enforcement and accountability. Are we having a program to deal with that? I think we can't just make a statement and don't have an action plan to say how are we going to do that. Second, Chairperson, is the gaps that exist, particularly in schools and healthcare centers. How do we close those gaps, Chairperson? What is it that must happen? I think that is very much important. And also, Chairperson, adding to what Honorable Sene is saying in relation to other stakeholders, because most of these things of rape is happening on the grassroots level. How do we leave the ward committees? I think they are also important stakeholders, because in the formation of ward committees, they are having desks. I think there is a desk that deals with the issue of health and safety. I think we must also look broad in relation to that, so that relevant stakeholders, we don't leave them out. Thank you, Chairperson. That would be my input. Thank you.
Thank you very much, Honorable Khumalo. Honorable Mtubatse.
No, thanks very much, Chair. And I'll request to switch off. I'm not in a good space in terms of network. But thanks also
noted,
to the
honorable member. Noted.
No,
yes, you may proceed.
No, thanks, Chairperson. I also want to welcome this important presentation by the content advisor, but also to mention that we must not lose sight of the fact that one of the contributory factors to statutory rape in our society is also the increase of drugs and alcohol that are being pushed in our communities. And I think all the work that we'll be doing, collaborating with other departments and other sectors and stakeholders, we must seriously come together and say, how are we going to deal with this scourge that is in our community, especially drugs and alcohol that is being pushed into black residential areas, if I may say. So we need to look into that particular aspect. Secondly, in terms of the stakeholders, I think we are losing sight of the traditional leadership, which can play a pivotal role in assisting, because you'd know that in different areas, especially in the rural areas, such matters are ignored and they are treated culturally. You find that there will be this issue of like taking a young girl to say she must be married at a particular age. So we need to have an engagement with the traditional leadership and look also at the cultural aspect in those areas. So my view is that the inclusion of the traditional leadership will be pivotal. Extending around the NGO, the civic society, as members have said, that must be clear. I think it will be key that we have collaboration with those civic organizations in our communities so that we can add an impetus to the work that we'll be doing. Thanks, Chairperson.
Thank you very much, Honorable Member. Dr. Leroux, let me give you the platform.
Thank you very much, Chair, and thank you to the Content Advisor for her report. I'm sorry that I haven't been able to attend the hearings over the last few days, but it is a topic that I think is very, very important, and I think firstly, I'd like to say that I think that the responsibility, it is indeed a problem that needs to have a whole of society approach and has to span several departments. But I think that as the Department of Health, we have a primary responsibility to facilitate the processes around statutory rape. Now, I think that we need to recognize that statutory rape is about the age of consent, and it is about sexual behavior or sexual intercourse that happens before the age of consent, which is 16 years. So anybody under 15 years and younger, it is basically defined as statutory rape. But we do know that some of those relationships that happen between two 15-year-olds, for example, are often consensual. And so I think that there's that group of children or young teenagers who we need to recognize in this whole process. I think the other thing about statutory rape is that because they present there's obviously a lot that we cannot pick up and that we don't pick up, but we pick them up mostly when they come to health facilities and when young girls present to health facilities with pregnancy or requesting contraception. And I think that that's where through the Children's Act, healthcare workers have a responsibility to report these cases. Now, it seems like in the law and in terms of prosecution, if there is a less than 2-year gap between the two partners, they tend to not prosecute them. If there is a bigger gap than that, and of course we're particularly concerned about much older men having sexual relationships with young women, that is where there's a form of manipulation, or sometimes not just manipulation, but forced sexual contact. That is, we should be really concerned about. And so I think that there is a lot of things to assess here. As a doctor, when I worked in the rural Eastern Cape, whenever we had a child who was pregnant under 16, we would refer them to the social worker and that would be assessed. And I think that is a good place to start. But I think it's very, very important that good protocols are in place. And I think that if there's any doubt in that investigation of the social worker, that should be referred on. And I think we do need to have better statistics on this. And I think that we need to be very, very aware of the interesting legal aspects of this, because of course, if a 14-year-old is pregnant, we have DNA evidence. And so in some ways, the prosecution is easier than in a case of rape where forced rape perhaps at another function when DNA evidence is much harder to get at times, and so we have DNA evidence lasting for months to years after this has happened. So if the young girl is able to tell us who the person is, it's very easy to see whether that person is guilty or not by using the DNA evidence, taking some blood or a sample from the child who is born. And so I think that this is an important thing that we need to recognize is a way that we can actually deal with some of the issues that are there, and it's a fairly much easier. The burden of evidence is easy to get in statutory rape and with children, or with when babies are born, than for example a case of rape where a person presents 2 or 3 days afterwards and much of the evidence is no longer there. So I think that there's a whole lot of things to consider. I think that I personally really strongly believe that each Department of Health, each provincial Department of Health has to have a very strong protocol in place for what nurses and doctors need to do when they have a case of any child who seems to have conceived before they turn 16. So even if you have a 16-year-old who's pregnant, we should be working backwards from when that child was conceived, and if there is any concern, that should be referred to a social worker, and the social worker should then be making a decision about whether this should be referred on to the police or not. And I think that every single case like this needs to be, and as far as I understand it from the Child Act, every single case of these needs to go into the child register. So my two questions really to the content advisor is in terms of the child register and the child sexual offences register, where are we with that? Are these cases being reported to that? And secondly, how often do we use a buccal swab or a blood sample from children who are born to young girls to prosecute men who have engaged in unlawful sexual conduct with minors? Those are two questions that I'd like to ask. But thank you very much for the opportunity, and thank you for the report.
Thank you, Dr. Leroux. Honorable Shabangu.
Thank you, Chairperson, and thank you from the content advisor for the information that she has shared with us. Chairperson, I must say that we were fortunate that the Portfolio Committee for Women, Youth and People with Disability was out into the two provinces to embark on this task of statutory rape. And Chairperson, one must say that the content advisor touched on a lot of things that we got from many stakeholders that we met, including the NGOs, which they were missed in this presentation, but they were part of the stakeholders that we met. This crisis of statutory rape, it is caused by so many factors. I cannot say much on it's a lot of factors. It's social issues, vulnerability of a child, where the perpetrator is a family member, is a provider, is fear of stigma, is lack of sexual education. There are so many factors, the culture and gender. You know, we met with the traditional leaders, or now they call it Traditional Council in Eastern Cape, and they were saying that dealing with these issues of culture, but the other group was saying that the issue of Gutwala is still a challenge. Yet the traditional leaders were saying they're dealing with it and it has come down. What one can say is that we do have the Children's Act that is very clear that if one comes across with the case of statutory rape, maybe let me say during my times while I was still working in the hospitals, it was mandatory that if you deliver a girl who is young, that time it was not even 16, we were reporting even the 18-year-old, it was mandatory that you will report that as a criminal case. Then the social worker will take that further, the investigations will be done. And I want to believe that the Child Act is still there for mandatory reporting. But what we got is that some they were saying there's ambiguity in with the act. They were not specific. But what we picked up is that people are now afraid of reporting. It can be teachers, nurses, whoever, because any member, even if it's a community member, need to report is the statutory rape. And there's just cracks between in this reporting in the mandatory reporting. The statutory rape they don't report, and also the stakeholders, departments, and these NGOs, police, NPA, Department of Health, DSD, whoever that is supposed to be part of this, they don't work together. We got different reports. That is why I'm saying that this information from the content advisor is exactly what is happening on the ground. Hence, we have this scourge of statutory rape not being managed correctly because the roles are not well coordinated. Each department gives you different stats. So, I mean, we can talk as much as we can. Maybe we need to look into this Children's Act and identify if maybe there is any loopholes or any area where we need to reinforce the legislations and the act to ensure that every member of the public, the teachers, the nurses, all the departments, that they play their roles as they are required by the law. Because all these gaps that are there in relation to what is supposed to happen, we can't be putting laws and legislations and acts, yet nothing is happening on the ground. Maybe my thinking is that we need to maybe revisit this Children's Act and see if everything is in place, and then come up with the ways of reinforcing the act, the actions by the different departments and the stakeholders. Because this thing of the case will be open, and then because of the discussions between family members, and they pay some monies or cows, then the case will be withdrawn. And I don't want to say much on what is happening with the NPA, the cases that are they are thrown out and they are not registered. The stats that is not talking to the other department will say this and the other department will say this. It's something that really leaves much to be desired, but definitely there's some missing information on this presentation, but it touches a lot on what we discovered as we were in the two provinces, especially the lack of mandatory reporting, which is all about fear of standing in the court, testifying or open a case. Those were the things that I just wanted to contribute. But thank you so much for the opportunity and the presentation by Spoas. Thank you so much.
Thank you very much. It's Ms. Ngomane who has presented. Can we go to the next member?
Ngiyabonga Sihlalo. Greetings to yourself, members and staff members, and immense gratitude to the content advisors for their presentations. Sihlalo, we just have one request in regards to guiding this process, especially Masisiwenza awethu ama stakeholder engagements. Sicela ukuthi i-justice and constitutional development nayibe khona in these engagements. We think that's the outstanding stakeholder, and I think they are very crucial to guide this process in terms of things that happen after arrests. and all of that, and also with creating or formulating legislation to strengthen the already existing legislation. And then second to that, if we can include NGOs that are not necessarily funded by DSD, that would also assist, Slalo. I think the NGO space and DSD has its own politics, and it would also guide our scope and our view in having NGOs that don't receive funding from DSD to be able to tell us who do this work, to be able to appraise us on what they find, especially grassroots NGOs that exist in communities that are overlooked. But otherwise,
Thank you very much. Next member, Dr. Chape.
Thank you, Chair. My having been on this tour, I'm pleased to hear that a lot of work will be happening. And I think it's going to be important that from Parliament side, there be coordination so that we don't have disjointed discussions in small committees. The women, youth, and persons with disabilities are the lead committee. And I'm aware that there's a meeting that is being arranged for Monday where all of us will participate and the chair of chairs will lead the debate. The things that everyone have said are relevant. But one of the issues that has come out for me is the issue of non-communication, deciding for people that are going to be impacted without engaging them. So it's clear that the customary ways of our people contribute to this, or in a sense are being criminalized without engagement, without education. And what has come out as well is the challenge of enforceability of the laws that we've created. One of the things that have been highlighted is the challenge even to be able to prosecute successfully when we have this issue where a 12-year-old is capable of having a termination of pregnancy on her own and making that decision, but cannot consent to sex, but can make major decisions on a byproduct of something that we feel is a violation, and they are expected to go on their own, amongst other complications. Then, as others have alluded, there's the issue of how teenagers, I was just reflecting on this and saying, I'm glad I'm the age that I am, because when I grew up, it means I would have either been a perpetrator or a victim or both, given the norms that happen in high school. And that creates the difficulty in policing. So part of the issue that this issue that have come up is the fact that we probably need to have a more holistic discussion. And I agree with the previous honorable member, Chiromponga, that we need to bring constitutional development and justice into this issue. Because one of the issues is that even with the little reporting that is occurring, there's no uptake in the police. So when we're talking about mandatory reporting, how is it going to contribute when the cops are not resourced, where there are not enough police stations, where there are not enough people to investigate? So even all those issues about how we resource this and how we enforce this, and whether it is enforceable in its current form, has to be part of the discussion. So I hope that the information will be sent through, that all of us join that virtual meeting that will be co-chaired by women, youth, people with disability, and I hope the chair is also involved. But more importantly, the chair of chairs will be the one that is coordinating that. Thank you, Chair.
Thank you very much. The next speaker is Honorable Mhlongo. Can you unmute yourself, Honorable Mhlongo? Honorable Mhlongo. In the meantime, let me come also, honorable members, out of the discussions and
Sorry,
what
Chair.
Oh, noted. Honorable. Yes, Honorable Mhlongo.
No, it's not Honorable Mhlongo. Mr. Zungula and Mr. Van Staden's hands are up.
Okay. Let me give it to you, Mr. Honorable Zungula.
Enkosi Sihlalo, greetings to you, the colleagues, the staff, and everyone present on the platform. Firstly, I want to appreciate the work and the presentation done by the content advisor. The question I have is perhaps to ask whether is there any form of research that has been done on the levels of enforcement for the laws pertaining to the issue of statutory rape? I'm asking because one of the things that usually happens when committees embark on such initiatives, one of the things that follows is a change in legislation or an update in legislation. However, what we do not perhaps look at first is whether the current laws are basically enforced in maximum levels. So it makes it difficult for us to really to check whether is the problem that we're facing as a result of poor law enforcement or the laws themselves are inadequate to address the problem. The second issue I want to raise is the question of one of the problems that we face in the country is the issue of in some instances, it is the actual parents who are the ones that are the culprits. In poverty-stricken communities, it is the parents that actually encourage their children to engage in such unlawful activities because they want some form of reward or money in return or food and alcohol, etc. So I think one of the things that we need to have a look at is how there could be stringent laws that are targeting some enablers. In this case, it would be parents, because in some communities, you find that the parent will know that there is some violation against the child, but instead of the parent going to a police station, instead, they will have a discussion with the perpetrator with a view of ukuhlawuliswa, whether ngegusha, ngebhokhwe, ngezinto ezinjalo. Therefore, I also want to agree with the sentiments that has been raised by one of my colleagues on the issue of education and informing, especially the parents, about what is legal and what is not legal. And when something unlawful has occurred, what then becomes the responsibility of the parent, so that we move parents, especially in poverty-stricken areas, rural areas, from ukuhlawulisa abantu iphelele apho into without actual prosecutions. So I wanted to raise those issues. However, I think also we also need to look at the issue of perhaps the role of the Portfolio Committee of Health needs to look at this question from a health perspective. I know it's something that is taboo, especially when it comes to our African communities, whereby children are encouraged, for example, to be on prevention, because at that age they are not legally supposed to be engaging in such activities. But some parents in some communities actually do it because they are aware that some of the things that may happen may be unlawful, may be illegal. So to prevent the child perhaps from getting pregnant or contracting some diseases in the process, there must be some form of protection. So perhaps share what I would implore from my side would be if the Portfolio Committee of Basic Education focuses on or comes with the angle dealing with the education aspect, social development, the aspect that is relevant to them. I think if we can focus on our side, the health aspect as to how do we in this pandemic that we have find a way to protect children, even though to prevent any form of diseases that may happen from unlawful activities or illegal activities.
Thank you, Honorable Van Staden. Oh, yes.
Sorry, our chairperson.
Can you hang on, Honorable Van Staden? Let me give it to Honorable Mhlongo to come first. Honorable Mhlongo.
Thanks, Chairperson. I'm very sorry about what has happened. I tried to unmute and then I had a problem. But anyway, good morning, honorable members, and thanks to our content advisor, Lindogu Hlengo Mane. Thank you for the presentation. I think we need to include the community. The community needs to be included because the occurrences that took place most of the time took place in the vicinity of the community. So the community involvement is so crucial, as well as the churches. We need to make awarenesses here. The youth desk need to be utilized. Youth leaders need to take the lead, and the traditional leaders as well, and all the centers that are available to give information to the youth, that needs to be utilized as a mode of prevention. Information needs to be cascaded to all, including the parents, through community awarenesses and campaigns, and awareness to schools and inclusion of this topic as they are doing or conducting sexuality education session that is conducted by the school health teams in their sessions. So we cannot wait for the incident to take place and then we try to ensure whether it was reported, do we have the case or we don't, but we need to make people aware, because there are differences between statutory rape and the rape. The statutory rape, the age by the state, the statutory rape, and the age of consent. Embarking on prevention programs, overcoming social norms, and engaging in consistent conversation around the consent and sexuality activities. Those are the dire need for us to understand regarding the consensual rape. And there is a difference between sexuality education and sex education. So people need to be made aware that no, we're not preaching sex education, but we are embarking on sexuality education, and that includes or that contains the information on how to prevent it, how to prevent unwanted diseases, as has been alluded prior. So a lot can be done, but we cannot leave the community. That is all that I wanted to say. No, we need to involve the community in our endeavors. Thank you.
Thank you very much, Honorable Mhlongo.
Thank you, Chairperson. Can you hear me?
Yes, you are audible, Honorable Member.
No, thank you. No, this is a matter that is always making me, how can I say, a bit furious when I talk about this, and I can tell you why. In 2007, when I was a community leader in my community, there was a heartbreaking incident taking place that was widely reported in the media about a 7-year-old girl that was raped and murdered. And the heartbreak the effect of heartbreaking not only on the community but on the family of that child as well was, I can't describe the experience we have underwent through to be in this process. And I've been sitting through the court cases for 2 years before the conviction was finally, judgment was finally given by the High Court in Pretoria. But this is a matter this is a serious matter and that affects all the communities in South Africa. And I think it was for long being overlooked, especially by Parliament. I'm glad to hear that there will be a meeting on Monday, and I also plead and I hope that we all will be involved because I would like to take part in it. But we must not only look at legislation, but we must also look at the law enforcement, the National Prosecuting Authority, the courts, etc., etc. And what the last speaker was saying just before me, the involvement of the communities is very, very important in this matter, because it's not only the family members, but it's the whole communities as well. But when such a situation occurs and happens, and when a life is lost, it breaks the whole community. Till this day, Chairperson, it still affects me, as who was a community leader at that stage. That incident has still affected me. And this is a matter that we must seriously giving attention to, and to come up with some sort of resolutions to try and to resolve these matters, because at the end of the day, it is our children in this country that is suffering the most. Thank you very much.
Thank you very much, honorable members. You have said a mouthful. Honorable members, coming to the subject under discussion, I just want first to appreciate your work, Ms. Ngomane, in coming with this information. It's good that there has been these stakeholder engagements, but I want to take the approach that says, let's look at this as to look at what our role is as this portfolio committee regarding the matter. Let's look at the crisis from a health perspective. I wanted to echo that yes, there's so many committees involved. Ours is to look at it at a health perspective. What role do we have as this portfolio committee regarding the subject? There are so many stakeholders identified, honorable members, but as the department, as the portfolio committee on health, we have our own stakeholders that have been recommended. Ms. Ngomane suggested that we may add to those that she has listed. I took note of NGOs, and I want to confirm that they were part of the stakeholders that were engaged in that stakeholder engagement to provinces. We may also add those NGOs to our own stakeholders as the PC on health. Also, justice and constitutional development. That committee is also participating in the process. I think, honorable members, it's also important to bring to the attention of the committee that the Department of Health, as one of our identified stakeholders, is yet to come. We will have our own meeting as PC, engaging our own stakeholders. So they are also key as the department. They will come in front of the Portfolio Committee on Health and make a presentation. We entertain their presentation. It's good that we have different experiences got from individuals on their experiences and the experience that we got from stakeholder engagement. My question that is directed to you, Ms. Ngomane, is can you clarify me on the issue of a minor and age regarding statutory rape? Because there is somewhere a confusion around there. Who is a minor? What age? Which age do we refer that this is a minor, this is underage regarding statutory rape now? I also agree with the honorable member that highlighted a gap in the Children's Act now, where I also noted the issue of termination of pregnancy. I think we need to identify those gaps going forward so that come the 30th of November, where Parliament will be entertaining the report of the whole program, we are clear of what we will be putting in that report that will be presented as this portfolio committee. But the gaps that you have identified, those that have been left behind as stakeholders out that we need to engage as this portfolio committee, I take note of that. The issue of traditional leaders also was prioritized by the joint oversight to provinces. They were there. As much as we are not giving the report of that assignment, but we need to highlight the things that were there. Traditional leaders, we may think of including them in at a national level because then they were participating as a stakeholder at a provincial level. We may, but key is that the leading portfolio committee, we must give such advices to that leading committee, which is women, youth, and people living with disabilities. I just wanted to have a comment on that and also have this direct question around age on statutory rape. That one is a direct question from my side, which I think we need also to not to drop the ball as this portfolio committee, because there are still activities to come that will need our attention. To you, Ms. Ngomane, we appreciate, but this issue of age regarding statutory rape is my interest around the matter. I can refer to you now to say, if you have the ability to respond to some of the questions, this is the time. Over to you.
Thank you, Chair. Chair, just to mention that as I was listening to the honorable members deliberating on the issue, it's quite clear that this is a whole society issue. It's not just specific to the proposed stakeholders that I've highlighted. It's a whole society issue, and this first engagement is just the initial phase of the work that needs to be done. There should be a second phase that comes after this phase, after reporting, because we need to identify the gaps after this initial phase. And then when we move to the second phase, that's where the focus should move into meeting with communities, involving traditional leaders, a full-on public participation process, engaging with many more different stakeholders. But for this phase, some of the colleagues, PCs, they are already engaging in their own spaces. They are engaging the relevant NGOs, which some of them are cross-cutting, and we look as health in terms of which additional stakeholders that we can involve. Because some of them, as I was following the PC on women and youth and persons with disabilities engagement. Some of the NGOs belongs to the Department of Social Development, but they did engage with those just to get the ball rolling, to do the groundwork, and then so that when we table this report, we know that what's happening on the ground and what our role is as a PC on health. In terms of the specific questions, Chair, on the fragmented legislative framework, there's a need for consolidation of the existing laws. Members have touched on that there are laws, but they are implemented differently by the different departments. Hence, there's a need to foster the integration and coordination across the government departments and ensuring continual process of the laws. If there is a need for amendment, and this should not be a once-off activity, it will be an ongoing issue as it's a pandemic in the country. In terms of the accountability of officials, each department is responsible for that issue to ensure that in their strategic planning, they ensure that they have key performance areas and indicators on this issue so that they track it on their performance, because if it's not there, it will not be done and it will be a by the way issue. So even with the Department of Health, we need to ensure that this forms part of their planning and they report on it on their annual reports and also their annual performance plans. In terms of, I've touched the issue of NGOs, very crucial. I agree with 100% with the members that we need to engage further with the NGOs. This is just a start. We'll include all the relevant stakeholders going forward. Just that now the timing is limited to include everyone. Remember, we have to report on the 30th of November, report to the House on the 30th of November. So we would not have sufficient time to do a full-scale public participation process. However, the members are still at liberty to include other stakeholders which they feel that they should be engaged at this point in time. The inclusion of communities, that will be part of the further engagements and traditional leadership, yes. The issue of the child registers, the Department of Social Development maintains the register, while the Department of Justice and Constitutional Development provides it with the information on court convictions. But I'm not certain as to whether these are updated and yes. So when the committee engages with the other committees, maybe they can raise that with the other sister PCs in terms of that specific work. The inclusion of NGOs, I've already spoken to that. The research at levels of enforcement that has not been done, as members are aware that this work was there, but it was never zoomed into. So the research gaps are there. Hence, I propose that to meet with the MRC when they brief the committee, they can provide the data and the research or the research gaps that are there and what they've done in that regard. Education and awareness, I totally agree with the members and how this statutory rape and rape per se occurs in communities. I'll touch on the issue of the age raised by the chairperson. If we look at the Criminal Law Amendment Act, particularly on Section 15, it speaks to the age in terms of statutory rape to say that a person who commits an act of sexual penetration with a child who is 12 years of age or older, but under the age of 16, despite consent, this is a guilty offense, unless at the time of the alleged commission of such an act, the child was 12 years of age or older, but under the age of 16. Either 16 or 17 years of age, and the age difference between the two was not more than 2 years. So the Criminal Laws Act is very specific. In summary, it says that even though a child is defined as a person under 18, the age of consent in South Africa is 16 and includes same-sex sexual experiences. In addition, also our laws provide for a clause in gap exceptions. Children will not be criminally charged for consensual sexual conduct if both partners are between 12 and 16, and it's not criminal for a child under 16 to have sex with a partner less than 2 years. It's very complex, but when we talk about minors, basically it's less than 12 years, because these days we get children who gets impregnated at the age of 9 years. So those are definitely minors. So the laws are very specific, but as members have alluded to the fact that the enforceability of the laws is an issue. So when members engage with the other portfolio committees, some of the issues should be raised for further deliberation. I'll leave it there, Chair. Thank you.
Thank you very much, Ms. Lindo Kuhle Ngomane. Job well done on your side. You brought the information, the content around the matter in front of us. You are correct when you suggested that other things that have been raised here must be raised in that joint committee, because some do not necessarily need our attention as this portfolio committee, but are very much important to address the challenge that we are trying to address as Parliament. Thank you very much. I think, honorable members, when there are invitations for those joint meetings, we will share those invitations in the group through Ms. Machalamba. I think we must proceed to the next item now. At least we have our... Yes, Ms. Machalamba.
Dr. Lee Tlappe's hand is up.
Dr. Lee Tlappe?
Thank you, Chair. I just wanted to get clarity or maybe provide information. Through my understanding, there'll only be an inter-committee.
Are you stuck, Dr. Litlape, now? Dr. Litlape, we've lost you. We lost you.
Have you?
Can you start talking now?
Can you hear me, Chair?
Yes, now.
Okay. I'm just saying that my understanding is that a report that will go to Parliament will be an inter-committee report that is being led by women, youth, with people with disability. And just to say that all the points that have been made, NGOs were invited, all those issues were done, and the points that are being made are critical. But it's going to will be dependent on the chair and other chairs to ensure that there's a consolidated report and possibly a consolidated inter-committee common physical meeting to finalize the report. Thank you, Chair.
Yes, Dr. Litlape, I agree with you. Thank you very much. Let's move to the next item. Thank you very much, Content Advisor, for such a presentation. Let's move to the next agenda item that we have to consider and adopt a committee's oversight report on their visit to KwaZulu-Natal Province. Can that report be led and tabled? Oversight report to KwaZulu-Natal. Is it you again, Ms. Ngomane?
Yes, Chair, it is.
Yes, lead us. Lead us,
Thank you,
Miss.
Chair. Thank you, Chair. Chair, I will quickly go through the body of the reports and spend more time on the recommendations. This is the report of the Portfolio Committee on Health on the oversight visit to KwaZulu-Natal from the 25th to the 28th of March. The purpose of the visit was to assess critical steps in assessing the state of health care and infrastructure in the province, assessing hospitals, all the facilities that were identified, visit the mortuaries, visit CAPRISA, which is the Center for the AIDS Program for Research in South Africa. This is the composition of the delegation. The facilities that were visited are Gamalake Community Health Center, Park Rainy Mortuary, Dr. Pixley Gaseme, Isaka Seme Hospital, Phoenix Mortuary, Prince Mshieni Hospital, and CAPRISA. On the first day, the committee visited Gamalake Community Health Center. There, the committee had a meeting with the MEC and received a presentation from the acting HOD. They also received an overview of the facility by the head of the center, which is Dr. Shomwe. The committee went on a walkabout and observed that there's a shortage of staff and posts are frozen. The filing is done manually and in the infrastructure issues within that filing room. The casualty area lacks proper ventilation. Pharmacy had a functional conditioning system, and there are 4 pharmacies there. There are no vacancies. Then the committee proceeded to Park Rainy Mortuary. They had a presentation by the management there. The committee observed the lack of proper body disposal plan for long-term cases. Then the committee went to Dr. Pixley Gaseme Memorial Hospital. They held a presentation there by the hospital management. On the walkabout, they observed the Tutuzela Care Center, where the committee was shown a machine that is said to be a game changer in forensic medicine, which is colposcope. That's a bit of a tongue tie there. And then they visited the radiology unit and observed that the unit is fully equipped. Emergency unit, which has a resuscitation area. Then the committee visited Phoenix Medical Legal Mortuary. And then it was said that the mortuary services 3 major courts in eThekwini, which is Durban, Duzuma, and Verulam, 24 police stations and 7 major hospitals, and 5 CHCs and other small clinics. The committee went to Prince Mshieni Hospital on the 27th of March, and they had a presentation there. And on the last day, on the same day, the committee visited the Center for AIDS Program of Research in South Africa, CAPRISA, which is led by Professor Karim. Then the committee concluded its oversight and met with the MEC for that last debriefing meeting. And the MEC highlighted issues of human resources, staff shortages, lack of digitization of records, financial issues, infrastructure issues, poor ventilation, and the issues of the mortuaries, lack of proper body disposal plan. The committee made the following recommendations. The National Department of Health's electronic patient health record must be implemented in these facilities as an investment in digital health record system. The system should, once implemented, the staff should be trained on how to use it. National Treasury should request to allocate funding for the department to address the issue of electronic record keeping. There should be an immediate repair of the roof at Kamalake CHC. Inspection should be conducted on all the facilities, infrastructure needs, and maintenance issues. A budget should be set aside for routine facility upkeep and repairs. The department should engage the provincial treasury to advocate for increased budget allocation. Proper air conditioning and ventilation system should be installed, particularly at Kamalake CHC. The department should engage with local authorities to review policies surrounding the handling of unclaimed bodies. The mortuaries should develop a formal and standardized procedure for handling and disposing of bodies that have remained in the mortuary for extended periods. Furthermore, the mortuaries should engage the department and relevant stakeholders to investigate the possibility of arranging for a dedicated and systematic approach to identify the families and next of kin of unclaimed bodies. The mortuary should also explore options for the dignified disposal of bodies, including cremation, burial, depending on legal issues. That concludes the presentation on the report on KwaZulu-Natal. Thank you, Chair.
Thank you very much, Ms. Ngomane. That was the report on our oversight visit that took place from the 25th to the 28th of March, honorable members. Remember, as portfolio committee, we need to entertain the report, consider it so that the report can be tabled to Parliament. There you are, honorable members. Any comments? Any hands, Ms. Majalamba?
Chairperson.
Yes, Honorable Sine.
Thank you for the opportunity. Listening to our content advisor, and also I went through the report, Chair, and I was also there physically. I think and believe that this report reflects the true reflection of what transpired in that oversight visit to to KZN. So I would like to move, Chair, for the adoption of this oversight report as a committee. Thank you.
Sorry,
Thank
Chair.
you, Honorable Sene. Any other? Yes, Honorable
Can
member?
I'll call out all the hands that are up. It's Ms.
Yes,
Clark,
please.
Mr. Mutubatse, and Dr. Leroux. Thank you, Chair.
Thank you very much.
And Ms. Shabangu is the last one. So it's Ms. Clark, Mr. Mutubatse, Dr. Leroux, and Ms. Shabangu. Thank you, Chair.
Thank you very much. Honorable Clark.
Thank you, Chairperson. I also read through the report, and it's definitely the content is correct in terms of our oversight. The only thing that I'm concerned about, Chairperson, is there must be some kind of recommendations we put forward that, the recommendations that are within the report is realized within a certain time frame, because it doesn't help us spending all this money going on oversights and have recommendations as the portfolio committee is what our expectations are, but we don't get any report back that these recommendations have actually been achieved and what the timeframes will be. Thank you.
Thank you very much, Honorable Clark. Honorable Mutubatse.
No, thanks, Chair, and thanks for the report. I want to also confirm that the report covers what we did in KZN, and I want to also second the adoption of this report. Having said that, there are two things that I want to lift. One is the agency of the Prince Mshieni situation, because we did raise the question of the security and the risk that is there, especially with the shacks that are next to the hospital itself. And I didn't get that been lifted. But my concern also is what Honorable Clark is raising. How do we interact and get a feel of what we are doing or the oversight that we have done? There is feedback and agency on issues that we have highlighted as issues of agency. And how do we, that's the frustrating part. How do we get a feel and touch whether that work is happening? I'll give you an example. We went to Northwest, where we said we need a report in respect of a hospital that was built in a wetland. And to date, I don't know what is happening with that particular report. It's an issue of concern for me, whether the province did what we said it should do or it has not done what we said it should do. And such things fall within the cracks, and that is my issue of the report. If maybe we can help one another as to how do we get that feel. I hope you capture my concern, Chairperson, and thank you. I second the report. Thanks, Chair.
Thank you, Honorable Mtubatse. Dr. Leroux.
Thank you very much, Chair, and thank you for that report. I was also present, and I think that the report is reflective of most of what we spoke about. I'd like to agree with my colleagues about the fact that we need to have some mechanism of follow-up and review, and it is a pity that this report has come so late. It would have been good perhaps to have adopted the report a month or two after our visit, and then to have a second follow-up of maybe 6 months after our visit to see where we are with that. I think that's the only thing I wanted to say in terms of the report and in terms of, and one of the factors that was mentioned in terms of the electronic record. I do remember just raising a concern to the MEC in that meeting about I had spoken to some medical colleagues based in Pietermaritzburg with the challenges that they were having with the time taken with the electronic electronic reporting that they had to do in Harry Gwala Hospital. And I think that should just be reflected in the notes, that we do need to be aware of the challenges that there might be, and we do absolutely have to make sure that clinicians on the ground find the electronic record that we are going to be implementing user-friendly, and that it doesn't undermine the work that they're doing and undermine patient care. So just wanted to make sure that was reflected in the report as well. Thank you.
Thank you very much, Dr. Leroux. Honorable Shabangu.
I'm covered, Chair. Thank you. I wanted to second the correctness and adoption of the report that is done already. Thank you.
Thank you very much, honorable members. The report is adopted, but the honorable members are raising the issue of following up a mechanism that may be there so that when you visit a province, you make some recommendations and Parliament adopts that report. There must be a way, because it's not easy for us to go back there now. We have 9 provinces. There is many that we are doing, but there must be a way of having a feedback on the implementations of our recommendations. Thank you for that. I think that will reflect on the report. Thank you very much, honorable members. the report has been adopted. Let's go, Ms. Ngomane, to the next oversight report to the Gauteng Province. I give it to you.
Thank you, Chair. This is the report of the Portfolio Committee on Health on an oversight visit to Gauteng Province on the 25th of April. The committee decided to visit Tembisa Hospital following two recent fire incidents. One occurred on the 19th and the other one on the 23rd. The purpose of the visit was to assess the extent of the damage caused by these incidents. Additionally, the committee visited Rahima Musa Mother and Child Hospital to assess progress made by the facility in implementing the findings and recommendations outlined in the head ombuds report. This is the delegation that visited the two facilities. At Tembisa Hospital, the committee received a briefing by the acting CEO and gave the history of the hospital and that it is a 1,115 bedded facility. The services they render, the challenges were highlighted, the achievement they listed there. Then they went into the fire incidents that occurred, mentioning that patients were evacuated from that area that got affected, and they were referred to other facilities, Krizani, Bara, Eden Vale, Steve Biko, Tshwane, and others were discharged. And then another fire broke out on the 23rd within the same facility in the scanning room. The cause of the fire is said to be unknown. Emergency services were called. It was said that on the 25th, when the committee visited, a particular testing was conducted. And on observations, the committee observed that the facility is overcrowded. Infrastructure and safety concerns were noted. Fire damage and record loss. This was concerning to the committee, and there were no timelines for the repairs of the fire damage ward. And it was concerning that this fire occurred in a high traffic area utilized by both patients and staff, and it went undetected until damage had occurred. The lack of digitization, which is a major issue, and meaning that some of the files or records were gutted by the fire. Foreign, national, and cost recovery was expressed and noted by the committee. On a walkabout, the committee observed the fire-affected unit, and it was secured and cordoned off, but the smell of smoke was still evident. On general admission ward, the preparation of the general admission ward, the committee was shown in a ward intended to be used for general admissions at that particular point in time. The committee observed that the ward appears to be structurally intact and suitable for conversion. And then the committee proceeded to Rahima Musa Mother and Child Hospital and conducted the walkabout on arrival and observed the postnatal ward and noted that it has recently been refurbished, including renovated bathrooms, painted walls, flooring. This is a 40-bedded unit. Also went to the labor ward, which is it's a 9-bedded ward. Staff reported that 40% of the patients admitted are foreign nationals. The neonatal ward, it was explained that it experiences high occupancy rates, which reaches up to 140%, which is extreme overcrowding. Although the ward is designed to accommodate 35 patients, it often admits between 60 and 70 patients due to high demand. The infrastructure was highlighted that the hospital was built 8 years ago, so it's aging infrastructure and the population has grown. The committee went to the radiology department and noted that the facility has a functional CT scanner, which is very good, producing images within 3 to 5 minutes. There's also an MRI scanner. On fire safety, the committee noted that the fire extinguisher has not been serviced since 2023, which raised serious concern regarding fire safety. The committee received an overview of the facility by the hospital management, and they noted that they work with the Department of Infrastructure Development on maintenance issues. In terms of the recommendations on Tembisa Hospital, the department should urgently prioritize the establishment of a district hospital in the region to ease the pressure on the hospital. The National Department of Health, together with the Gauteng Department of Health, should engage National Treasury to explore the feasibility of assuming direct responsibility of its infrastructure projects instead of relying on the Department of Infrastructure Development. The facility should develop a hospital-level contingency and safety plan for staff and patients, and conduct fire drills and emergency protocols. The hospital should immediately assess and repair non-functioning security cameras. Occupational health and safety must be prioritized. That's in regard to the fire safety. The facility should expedite the clearance process for general admissions to ensure continuity. Environmental monitoring of the burn unit due to the lingering smoke and contamination. Fast track the investigation into the cause of the fire and ensure transparent communication. The Department of Health should secure funding and a dedicated project team to repair the damaged ward. Provide improve monitoring and patrolling protocols in sensitive areas to prevent similar incidents. Provide the committee with regular updates on the restoration process and safety clearance progress. On records digitization, the department should assist the facility in implementing an EHR system with cloud-based backups. Train staff on the use of the system. The recommendations on the Rahuna Musa and Child Hospital, urgent attention should be given to address the overcrowding and staff challenges. Consideration should be given to expanding or upgrading the infrastructure. Implement staff retention and recruitment strategies. Review resource allocation, especially in the neonatal care unit. Mechanisms should be established to identify and address operational challenges within the facility. On recommendation that cuts across the facilities, the Provincial Department of Health should allocate dedicated budgetary resources towards the installation of solar systems to ensure that power is not a challenge for these facilities. The department should ensure that all fire safety equipment are regularly inspected, maintained, and serviced. The department, together with the national department, should establish clear billing and tracking system for patients who are foreign nationals. A department should foster a supportive work environment where health professionals feel safe to voice concerns or grievances without fear of victimization and professional repercussions. Health professionals should properly be equipped with the necessary tools, equipment, and support systems to perform their duties. A department must strengthen its long-term infrastructure and human resource planning to accommodate the growing populations. Health facilities should consider the insourcing of critical services such as cleaning, security, catering, and maintenance. The National Health Council could relook into the issue of committed overtime in RWAPs. That concludes the report, Chair. Thank you.
Thank you very much, Ms. Ngomane. That is the report, honorable members. I think let me give it to you to comment on the report. We'll note hands. Someone else will be assisting me to identify those hands. Can we comment, honorable members, on the report of the oversight visit to Gauteng Province? Any indications or appetite to comment? Honorable members, are you there? Can I note hands?
Yes, Chair, I'm here. My hand is up. I was waiting for Ms. Majalamba to identify hands.
Ms. Majalamba has got an emergency now. There's somebody else who's assisting. Who are you who's assisting Ms. Majalamba? Can you note hands?
The hands of Mr. Mutubatse,
yes,
followed by Ms. Clark, then Dr. Leroux. These are the three hands for now, Chair.
Thank you very much. Mr. Mutubatse, the platform is yours.
No, thanks very much, Chair. I want to take this opportunity to welcome the report as it covers a true reflection of what transpired and suggest that I move the report. But Chair, one issue that is common, and I want us to help one another, the digitization rollout. This is a nightmare, especially when it comes to, one, helping the registration as per the NHI program. That is the first thing. But also the identification and sifting between ourselves as South Africans and foreign nationals, because one of the things, I mean, the loss of medication that was found en route to Zimbabwe and Limpopo, one member was saying it is not as a result of stealing, but it is as a result of us failing to identify the collection of patients moving from one hospital to another, collecting this medication and taking it abroad. It might arrive at the conclusion that that is stealing. But how do we begin to finalize the digitization?
Digitalize.
Yes, nationally, because I think this will help, and I think at some point we must come together with the department to say, please, let's help one another around this issue. It's frustrating me, and I want you, Chairperson, to help us to deal with this particular issue, lift it as our pillar and take it forward so that the department can help us in this issue. Thanks, Chairperson. I move the report.
Thank you very much, Mr. Mtumatse. Your concern is noted. Maybe when we invite the department, we may say we present that they respond, but we will have a way off-site the meeting. Honorable Clerk.
Thank you, Chairperson. I would like Dr. Leroux to comment on this report because I was not with when they did this oversight. So I'm not able to comment on the report. Thank you.
Thank you very much, Honorable Clerk. Dr. Leroux.
Thank you, Chair. Can you hear me? I'm just trying to put my camera on as well, so that you can see me. Thank you. Yes. I'm also happy to with the contents of the report, but I would just again like to raise a concern in terms of follow-up here. I think it was very important and very good that we went and we responded to the fire at such short notice. Of course, we know that there's been a lot of movement at Tembisa with the SIU report being released, and there has been it seems some movement in the from the police side as well. But I do think that it probably would be sensible for us as and the right thing to do as a committee to follow up this report in person at some stage in the next few months, and do another visit there and see where we are with the recommendations that we've made. But I am happy to move for the report to be adopted. Thank you.
Thank you very much, Dr. Leroux. You were seconding Honorable Mtubatse, meaning that the report has been adopted. But we need to consider the issues that were a concern outside the oversight report. There are issues raised that we need to take them forward. Thank you very much. The report has been adopted. Can we go to minutes now? Can we go to those set of minutes? The minutes in front of us are the minutes of a meeting that took place on the 29th of October. Can we consider those minutes, honorable members? The first page is about who was in the meeting.
Okay.
Yes,
so
I know.
There's also a set of the 22nd. Can you start with those, please?
The ones of the 22nd. Okay. My apologies, honorable members. Let's start with the set of the 22nd before we can entertain the ones for the 29th. Please, honorable members, let's go and attend to those of the 22nd. What do you suggest? Must we go page by page? You did receive the minutes. They are there now in front of you. They are flighted in our screens. Honorable members, that page is with credentials, whatever by the chair, the briefing by SARS. There it goes. There it goes. There it goes. There it goes, honorable members, the briefing by SAPS. There it goes. There it goes, honorable members. There it goes. There it goes. Yes. As you can see, yes. Then there was that presentation. There it goes. There it goes. There it goes. There it goes. Then is the last page that talks about adjournment. Any comments, honorable members?
Chair, thank you. We received
let me note hands. It's Honorable Shabangu. Yes. Any other member with a hand? You can proceed, Honorable Shabangu.
My hand is up.
Yes, Honorable Kumalo, but let's wait for Honorable Shabangu. She's on the platform.
My apologies, Chair, for talking without you recognizing my hand. I understood that Ms. Majalamba is out of the meeting for a while.
Yes.
I wanted to propose the adoption of this minute as a true reflection of the meeting that took place. Thank you so much.
Thank you very much, Ms. Shabangu. Honorable Khumalo.
Chair, thank you very much. The minutes are the true reflection of what was discussed on that day. I therefore second the adoption of the minutes.
The minutes have been adopted. Let's then proceed to the next set of minutes. That is the minutes of the 29th of October, honorable members. Can you flight them? Yes, Lindo Kuhle. The first page on who attended. The second page are the remarks about the presentation of on the metrics. There you go. The third page. Consideration on the legal opinion. There it goes. That is page 3. There it goes. Then it's on the last page, which has got any other business, and then the adjournment. Any takes, honorable members?
Chairperson.
Yes, Honorable Sanne.
Chair, I would like to move for the adoption of these minutes. We have received them and went through. Thanks, Chair.
Thank you very much, Honorable Sanne. Any other member who has got an appetite to second or do whatever?
I second is Honorable Sanne. Thank you.
Honorable Shabangu is seconding the second set of minutes. The two sets of minutes have been adopted, honorable members. Thank you. Let's now consider the last item on the agenda, honorable members. That item talks to the statutory that was talked about at some point. Honorable members, the person who was to lead on the item is Ms. Majalamba. I am not sure whether she is back in the platform, but I think Lindo Kuhle, she has left you. Can you take us through the item, or is Ms. Majalamba back? But what he said to me was very much important. It's a family matter that has affected her, but I think let's entertain the agenda item.
Yeah, sorry to interrupt, could I just ask a quick question before we go to that agenda item?
Honorable. Yes, I give it to you.
I just wanted to ask, we had the issue at that meeting on the 29th in terms of the voting rights of an alternate member for the smaller parties, which was raised, and we weren't able to get a determination about that at the time of the meeting. I just wanted to follow up to see whether we have, in the meantime, got a determination whether Honourable Zungula was able to vote or not in that meeting. Thank you.
Thank you very much, Dr. Leroux. The answer that I can give is that, as I alluded to the fact that on that meeting, that there may be gaps in the rules. What Vuyokazi shared with me was that she does not have a straight answer to that what was raised in that meeting. We're still consulting. She is still consulting within Parliament. I don't have a straight answer now, but the matter is under consideration. What is important is that I take note of it so that come other meetings, we don't have a confusion around that. But there's no direct answer as of now, Dr. Leroux.
Thank you very much,
That's the only answer that I can give. Thank you.
Thank you. If I could request that we, perhaps in the next week or two, when we get an answer, that is just fed back, given that feedback is given to the committee, so that we have clarity on that point.
In order. That's order. That's in order, Honorable.
Thank you very much, Chair.
It will happen. Yes. Ms. Ngomane, can you take us through the last item, or if Vuyokazi is back, just alert us. Are you able to take us through that time? You are back, Vuyokazi Machalam?
Yes, I'm back, yes. Chair.
Okay. Thank you very much for that.
Issue that Dr. Leroux has just raised. I did consult with my line manager, and he shared the same sentiments that we shared, that according to the rules, as we are guided by the rules, Mr. Zungula is not supposed to vote. He indicated that an alternate, as I read last time, an alternate acts as a member when the member for which alternate was appointed is absent or has vacated the office. So he also said that the rules, because we are guided by the rules say that a member can only vote for a party that he was appointed for. But I will further ask him to discuss the issue with the NA table. But the rules are clear that you only, when a member for which the alternate was appointed, I think that is the part. But we will continue, we will give an answer again, a response again in the next meeting. Ms. Clark's hand is up.
Honorable Clark, can you take the platform?
Thank you, Chairperson. I think it's important that it is discussed with the legal team at the table of Parliament, and if either Mr. Castle or the House Chairperson can provide us with a letter of clarity, because then we know going forward what we need to do and what we don't need to do. Thank you very much.
Thank you very much, Honorable Clark. As highlighted earlier on, honorable members, that means a feedback must come back around that, must come back to the committee so that everyone is clear. We take note of what Ms. Machalamba is saying, but let her continue so that we have something as to close the matter. Thank you very much, honorable members. Appreciated.
Mr. Mtubate's hand is up, Chair.
Mr. Mtubate, I give you.
No, thanks, Chair. I think in the investigation, to get clarity, let us tweak it a bit, because the concern was about the minority parties.
Yes.
In the committee. What happens, because they need to agree on who is going to vote. For an example, I think in the National Assembly sometime last week, where Mr. Adams was to make either declaration, he was informed that in fact he's not on that list, because that's what the minority parties has agreed on who will be making a declaration. And I think this situation is similar to that one, not on the alternative on members who are on the alternate on members who are in the same party. I just wanted to add there that investigation must help us also to unravel that particular part. Thanks.
Yes, Honorable Mtubadze, I also observed that during that plenary. But let it be that homework. We will get a feedback. Thank you very much. Just take us through the last item of the agenda, Ms. Machalamba.
Thank you, Chair. For the study tour, we have identified Thailand. Because of its health system, they have achieved the universal health coverage, and we thought this will provide an opportunity for learning for the health committee. Then on the travel dates, let me first start that we also chose Thailand due to budget constraints. We have our balance in the committee. We have a budget of 2 we are left with 2.4 million. So we thought this would be enough because we are hoping that all the members of the committee will be able to travel. That's why we also chose Thailand, because it's cheaper than other European countries or other countries. Then on the travel dates, we have identified the 23rd of January as a departure date from South Africa, leaving Thailand on the 31st of January. So it will be a week. But I should also emphasize, Chair, that the House Chair has also reminded us that legislation remains the committee's priority and that he will only consider the study tour after the committee has completed the bill. Thank you, Chair. I'm not sure if members want to make any inputs or on the country that we've chosen or on the dates. Thank you, Chair.
Thank you very much, Ms. Majalamba, for that update. Honorable members, I give it to you to comment. One, as Ms. Majalamba has proposed, you may comment on the country that has been identified. The issue of financial implications have been talked about. We all understood that, we understand that honorable members have got an interest in the study tour, but let me give it to you to comment. We will note hands, honorable members.
Ms. Clark's hand is up, Chair.
Who else? You can take the platform, Honorable Clark.
Thank you, Chairperson. I also want to thank Ms. Majalamba for the effort she's been putting in trying to get this sorted out. And I think Thailand is a very good choice because they are rated as one of the best healthcare providers in the country in terms of universal healthcare. And I think we can learn a lot from them. That's just my comment. Thank you.
Thank you, Honorable Clark. Any other member who would like to comment on the issue?
Dr. Leroux, followed by Mr. Mutubat. Thank you, Chair.
Dr. Leroux.
Yes, thank you very much, Chair. Yes, I would like to echo the sentiments of my colleague. I think it's a country that is in a similar financial middle-income country like South Africa. It's gone over to universal healthcare fairly recently. I think that there are good lessons to learn, and I think it's a great idea, and are grateful for the approach. I'm a little bit worried about the timing in terms of the bill and whether we will get it done by then, because there are still quite a lot of things that need to be done. But I think those dates are good, and I think that the destination is excellent. Thank you.
Thank you very much, Dr. Leroux. Honorable Mtubatse?
No, thanks, Chair. I think I'm covered. I don't have to waste time. Thanks.
Thank you very much, Honorable Mtubatse. On that note, honorable members, I think we have come to the end of our discussions. Let me take this opportunity to thank honorable members for their attendance, their participation, and their recommendations in the meeting. Thank you very much, honorable members. Thanks everyone who connected to our meeting. Thanks very much. The meeting stands adjourned. Thank you.
Thank you, Chair.
Thank you very much, Chair.
Thank you, Chair. Long live.
Thank you, Chair.